So we'll look at the blood supply to the stomach, but it is important to first know a little anatomy of the stomach, because in the blood supply to the stomach, you would be asked in exams which arteries supply the greater curvature of the stomach or the lesser curvature of the stomach. But if you don't know where the greater curvature is or where the lesser curvature is, then it might be difficult for you to understand the blood supply, to the stomach. So that is why we would look at a little anatomy of the stomach and then look at the blood supply to each part of the stomach. So the stomach is this organ you see here. So here, from this picture, you see this is the esophagus, and then continues as the stomach. Then the stomach continues as the duodenum. And the duodenum comes, and then you see the small other part of the small intestine, the jejunum and the ileum. So then this is the large intestine, the cecum and appendix, ascending colon, transverse colon, descending colon, sigmoid colon, and then you have the rectum. Now, but our emphasis will be on the stomach, the anatomy of the stomach, and the blood supply to the different parts of the stomach. So what is the stomach? The stomach is the dilated portion of the alimentary canal or the digestive system, the dilated portion. It is situated in the upper part of the abdomen, extending from beneath the left costal margin region into the epigastric and umbilical region. So it is situated in the upper part of the abdomen. You know, here we have the diaphragm that separates the thoracic cavity or the chest region from the abdominal cavity. So this is the diaphragm. Now, on the left side, below the diaphragm or the upper part of the abdominal cavity, you have the stomach here. On this right side, you have the liver, but it's not shown in this diagram. So the liver is on the right, while the stomach is on the left. The stomach is situated in the upper part of the abdomen, and it extends from beneath the left costal margin region into the epigastric region and then the umbilical region. Now, much of the stomach lies under cover of the lower ribs. So some of the ribs, if you see the ribs, some of it covers, most parts of the stomach. And the stomach relatively fixed at both ends, but it's very mobile in between. So the stomach is fixed at both ends. At the esophageal end and at the duodenal end, it is fixed, but it is mobile, it is movable. Okay, now the anatomical description of the stomach. Now, anatomically, the stomach has a shape which is called a J shape. So here you see that this shape is like J. So this shape of the stomach is called the J shape. So the stomach is roughly J shaped, and the stomach has two openings. They are the cardiac and the pyloric orifices. So the cardiac orifice is the opening between the stomach and the esophagus. So this is your esophagus, and then this is the cardia, the part of the stomach called the cardia. So there is an opening here that connects the cardiac part of the stomach or the cardia part of the stomach to the esophagus. Now, this is cardia, not cardiac. So remember that this part of the stomach here is cardia, but the opening that connects the stomach to the esophagus is called the cardiac orifice. But this cardiac is not related to the heart. It has nothing to do with the heart, okay? And then the second, yeah, did you hear me?
Yes, I can hear you.
Okay. So the second orifice is called the pyloric orifice. So the pyloric orifice is down here. Now this part of the stomach is called the pylorus. This part is called the pylorus, or this is the pyloric part. So there's a connection between the pylorus and the duodenum. So there's an opening that connects the both of them. And that opening is called the pyloric orifice. So the cardiac orifice connects the stomach with the esophagus, while the pyloric orifice connects the stomach with the duodenum, which is the first part of the small intestine. And then the stomach has two curvatures, two openings, two curvatures. What are the curvatures? The greater and the lesser curvature. So the greater curvature is this big one here. You see this shape like this. This is the greater curvature of the stomach. You see that it is longer.
So,
yes.
I can't. What you're doing with the screen, I can't see it.
You can't see the screen? You said you can't see the screen. Hello? Okay, so we said that the stomach has two openings, the cardiac and the pyloric orifices, which you can see here in the lower diagram. You see the pyloric orifice here, this pyloric orifice, which is connecting the pyloric part of the stomach to the duodenum. And then here you will find the cardiac orifice, which is not properly labeled in this diagram. And then the stomach has two curvatures, the greater curvature, which is this great curvature like this, great one. And then this here, you have the lesser curvature. The lesser curvature is smaller than the greater curvature. These are the two curvatures of the stomach. And then we'll have two surfaces, the anterior surface and the posterior surface of the stomach. So the part of the stomach that you can see is the anterior surface. Then behind it, you have the posterior surface, which we cannot see in this diagram because it's located posteriorly. Now, the stomach is divided into four main parts. And these parts are the fundus, the body, the pyloric antrum, and the pylorus. Now, this pylorus contains the pyloric sphincter and the pyloric canal. So the fundus of the stomach, from this diagram, you could see this upper part, this upper pole of the stomach here is called the fundus. And this fundus has its own blood supply. And then we have this part, which is called the body of the stomach. So the body is the larger part that is between the fundus and the pyloric antrum. And then the third part is this place here we call the pyloric antrum. And then lastly, you have the pylorus. And this pylorus is made up of the pyloric orifice and the pyloric sphincter and the pyloric canal through which digested food moves into the duodenum. So you have the pyloric canal and the pyloric sphincter. In the next slide, you will see the pyloric sphincter is actually some muscles that contract and dilate to open or close the pyloric canal for food to pass through the pyloric orifice into the duodenum. And then here we have another little part of the stomach, which is called the cardia, which connects the esophagus and the stomach. Good. Here in this diagram, you see the body, the fundus, you see the body, you see the pyloric part, pyloric antrum, and then you see the pylorus, the main pylorus itself. Now, there is something else you need to know. Here, you see what we call the angular incisor. angular this angle here is called the angular incisor. Okay, so let's look at the next slide. So parts of the stomach. The stomach is divided into the following parts. The stomach is divided into the following parts. The fundus. This is dome-shaped and projects upward and to the left of the cardiac orifice. It is usually full of gas. So the fundus is dome-shaped, projects upward and to the left of the cardiac orifice, as we saw in the previous diagram. And then we have the body. The body extends from the level of the cardiac orifice to the level of the incisura angularis, a constant notch in the lower part of the lesser curvature. So the body extends from the cardiac orifice. So let's go back to this diagram. From the cardiac orifice, so from this place down to this incisor here, this incisura. So all this place is the body, okay? Then we have the pyloric antrum, which extends from the incisura angularis to the pylorus. So from the incisura here down to the pylorus make up the pyloric parts, the pyloric parts. And then lastly, we have the pylorus itself, which is the most tubular part of the stomach. The thick muscular wall is called the pyloric sphincter. So the muscles of the pylorus, the walls are made up of thick muscles, and they are called the pyloric sphincter. And there is a cavity of the pylorus, which is called the pyloric canal, as we saw in the previous diagram. So here, you would see this fundus up here, and then you see the cardiac orifice, and then this is the lesser curvature, and this is the greater curvature. So we said that the fundus is the upper part, and it is dome-shaped here. It is to the left of the cardiac orifice. So this is the cardiac orifice, the left side of it, you find your fundus there. And then the body extends from this lower part of the fundus down to this incisura angularis, this notch here. So that is your body. And then we have the antrum, which is from the incisura angularis to the upper border of the pylorus. And then the pylorus is made up of the pyloric canal and the sphincter, and that sphincter is made up of muscles. So in this diagram here, you would find the pyloric sphincter. These are the muscles that make up the pyloric sphincter. And then you see the pyloric canal and the pyloric orifice. So what will happen when these muscles, when they contract and relax, they alter the size of this canal and the amount of food, and they allow food to pass through into the duodenum. Now, inside of the stomach, you see some fold, some longitudinal folds of mucous coat, which we'll call rugae. You'll see it in the next slide. So these folds are called rugae. Now, the muscles of the stomach are of two main types. We have the oblique muscle and we have the circular muscle. So the muscles of the stomach are oblique and circular muscles of the stomach. And all of these muscles, they contract to propel food, to push food from the stomach into the duodenum. So the curvature of the stomach. The stomach has two main curvatures, which are the lesser curvature and the greater curvature. So the lesser curvature forms the right border of the stomach. The lesser curvature forms the right border of the stomach, and it extends from the cardiac orifice to the pylorus. We saw that in the previous diagram. So remember that the right border of the stomach is the lesser curvature. And then we have it is suspended from the liver by the lesser omentum. So the connection between the liver and the stomach is the lesser omentum. And we would see what makes up the lesser omentum in the next slide. So greater curvature, much longer than the lesser curvature, and it extends from the left of the cardiac orifice over the dome of the fundus and along the left border of the stomach down to the pylorus. So let's see if I can see a diagram that will explain that. So we said from this slide that the greater curvature would be from here, extending from the fundus, and it makes up the right border of the stomach and extends down to this pyloric part. So this is the greater curvature, which makes up the right border, while the lesser curvature makes up the left border. And so this is the lesser omentum here. This lesser omentum is what is suspending the stomach and the liver. So the lesser omentum is made up of two ligaments. And these ligaments are the hepatogastric ligament, which joins the liver to the stomach, so hepatogastric. So there's the ligament connecting the stomach to the liver, so we'll call it hepatogastric. And then there is another ligament which connects the duodenum, this duodenum, to the liver, and we call it the hepatoduodenal ligament. So these two ligaments make up what we call the lesser omentum. So this is the lesser omentum here that looks like fats, right? So it is connecting the stomach and the duodenum to the liver. And the two ligaments, they are hepatogastric ligament and the hepatoduodenal ligament. Now, let's go back. So the gastrosplenic ligament or gastrosplenic omentum extends from the upper part of the greater curvature to the spleen. So let's identify the gastrosplenic ligament or the gastrosplenic omentum. Let's identify it. It extends from the upper part of the greater curvature to the spleen. So in this diagram, here you find the spleen just behind the stomach. Now, the upper part of the greater curvature, so we said this is the greater curvature. Now, the upper part of the greater curvature is joined to this spleen through the splenogastric ligament. So that ligament or the gastrosplenic ligament extend from the upper part of the greater curvature to the spleen. So that is the ligament connecting the spleen to the upper part of the stomach. And then we have also what we call the greater omentum. The greater omentum extends from the lower part of the greater curvature to the transverse colon. Greater omentum extends from the lower part of the greater curvature to the transverse colon. So where is the lower part of the greater curvature? So this is the lower part of the greater curvature. Lower part of the greater curvature is connected to the transverse column of the large intestine. So we'll have a transverse column here. Now, it is this is what we call the greater omentum. So this greater omentum connects the lower part of the greater curvature of the stomach to the transverse colon of the large intestine. So this is the greater omentum here. Okay. The last thing you need to know on the curvature is that peritoneum completely surrounds the stomach. So the stomach is covered by the peritoneum, which you might not completely see in this diagram. Okay. Don't worry about this diagram. So the openings of the stomach We have the cardiac orifice, which we said is where the esophagus enters the stomach here. And then we have the pyloric orifice, which is formed by the pyloric canal, which is about 1 to 2.5 centimeters long, or 1 inch to 2.5 centimeter or 2.5 centimeter long. The circular muscle coat of the stomach is much thicker at this pyloric orifice. So the muscle is thicker here and forms the anatomic and physiologic pyloric sphincter. So we have two sphincters, anatomic and physiologic sphincters, but they are not labeled in this diagram. But know that the job of the sphincters are to contract and relax, to control gastric motility, to control movement of food from the stomach into the duodenum. Now let's, so this is the wall of the stomach, a little bit of maybe histology. So we have what we call the serosa, which is consisting of layers of connective tissue continuous with the peritoneum. Maybe this we could do later when we are looking at the histology of the stomach, only the anatomy. But today, what I wanted us to know is just the blood supply, but I wanted us to know the surfaces, the curvatures, and the parts, okay? So this is just talking about the covering, the outer covering, which is the serosa, this one you see here. This is the outermost covering. It is called the serosa. And then you have the muscular wall of the stomach, which contains longitudinal fibers, circular fiber, and oblique fiber. So this is talking about the muscles, these muscles here. So we have the longitudinal layer, the circular layer, and the oblique layer. These outer muscles you see are longitudinal, the middle ones are circular, and the inner muscles are oblique muscles. So these are the muscles that make up the wall of the stomach. Then we'll have the mucous membrane, which is thrown into numerous folds or rugae. So I mentioned this rugae in the previous slide. So you see these folds here, these stomach folds are what we call the rugae. They are mainly longitudinal in direction. The folds flatten out when the stomach is distended. So when the stomach stretches, these folds, they become flat. Okay, good. Now let's see, let's go to the blood supply. Relations of the stomach. This we'll do when we are talking about the anatomy of the stomach proper, but let's just mention it. So the stomach has anterior relations and posterior relations. So the anterior relations will have the anterior abdominal wall, which has been removed in the diagram. You can't see it. You have the left costal margin, it's somewhere here, left costal margin. You have the left pleura and the lungs, because just on top of this stomach here, on this left side, you have your heart actually on the left side, but then there's a part of the lungs also projects downward. So you have your left pleura and the lung, and then you have your diaphragm. I told you that diaphragm separates the abdominal region from the thoracic region. So the diaphragm is here also. So that is anteriorly related to the stomach. And then we have the left lobe of the liver. So this is the liver here, located more on the right side, but it has a left lobe. So this is the left lobe of the liver, and this is the right lobe of the liver. So the left lobe of the liver is related, an anterior relation of the stomach. So anteriorly, the stomach is related to all of these: anterior abdominal wall, left costal margin, left pleura and the lung, the diaphragm, and the left lobe of the liver. These are related to the stomach anteriorly. Then the posterior relations of the stomach will have the lesser sac, or what we call the lesser omentum. We have the diaphragm, because the dome of the diaphragm it has two domes. Some parts of that diaphragm, the dome of the diaphragm is related to the stomach posteriorly, so behind the stomach. Then we have the left suprarenal gland. So just behind the stomach here on the left side, on the left side, you'll find your kidney and the suprarenal gland, but it's not showing in the diagram. Okay, let's see this diagram. Yeah, so here you see the left kidney and the left suprarenal gland. So they are somewhere here. So they are related to the stomach posteriorly. And then you have the upper part of the left kidney is related to the stomach posteriorly. You have the splenic artery, of course, because the spleen is behind the stomach here. And then you have your pancreas. So your pancreas is running behind the stomach. So you won't see it in this diagram here. And then you have your transverse colon. So this is your transverse colon. You see a part of it is going posteriorly, posteriorly related to the stomach. And then you have your transverse mesocolon, which is not visible in this diagram. So these are the posterior relations and the anterior relations. So they could ask you in an exam, which of the following is not a relation of the stomach? Which of the following is not a relation of the stomach? A, left suprarenal gland. B, spleen. C, diaphragm. D, right kidney. Which of these is not a relation of the stomach? What would your answer be?
You said
I said
left
suprarenal gland, spleen, diaphragm, and right kidney. Which of these is not a relation of the stomach?
the right kidney.
The right kidney, good. So because the right kidney is very far from the stomach, the right kidney is a little bit lower than the left kidney. The left kidney is higher than the right kidney. Why? Because of the weight of the liver. The weight of the liver on the right side kind of pushes, makes the right kidney lower than the left kidney. So the right kidney is very far from the stomach, so it is not related to the stomach, whether anteriorly or posteriorly. The right kidney is not related to the stomach in any way. Okay, good. So let's look at the blood supply. I think the diagram is simply trying to explain what we already said about the relation of the stomach. That is what this diagram is talking about. Let's go to the blood supply. Good. So the blood supply of the stomach, which is the main thing that I want us to know, the essence of this lecture is the blood supply of the stomach. But we've already seen the anatomy of the stomach. So now when we say fundus, we know where the fundus is. When we say the body of the stomach, we know what it means and where it is. When we say the pylorus, we know what it is. When we say the greater curvature and the lesser curvature, we know where they are. So now we can talk about the blood supply of the stomach. Now, there are 5 main arteries that supply the stomach, 5 main arteries. Remember before we had said that the blood supply to the stomach is called the gastric artery. We just use the word gastric artery, as the blood supply to the stomach. But now we are not looking at the different branches that supply different parts of the stomach. So the first artery that you want to know, first of all, remember that all of these arteries are branches of the celiac trunk. We had said that the celiac trunk is the first branch of the abdominal aorta. Yeah, so that celiac trunk, which is the first branch of the abdominal aorta, is what supplies the stomach. So branches of the celiac trunk supply the stomach. So these 5 arteries are coming from the celiac trunk. Now, the first artery that supplies the stomach is what we call the left gastric artery. Now, don't get confused. Even though the name of the artery is called the left gastric artery, you will see that this artery actually supplies the right part of the stomach. So pay attention to this. The name is left gastric artery, but it is supplying the right part of the stomach. Now, This gastric artery arises from the celiac trunk. It supplies the lower third of your esophagus and the upper right part of the stomach. Upper right part of the stomach. Now, but the name is called left gastric artery. So most students usually get confused and they say that the left gastric artery supplies the left part of the stomach. That is not true. So the left gastric artery supplies the upper right part of the stomach. Now we need to identify that in the diagram. So look at this diagram here. Now we have said that this stomach, this part here, this is the left part of the stomach, this left border of the stomach, while this is the right border of the stomach. So remember that right border of the stomach, or the lesser curvature, is on the right side, because the liver is supposed to be somewhere here on the right. So this will be the right side and this will be the left side. So where is our left gastric artery? So here you see the left gastric artery coming from the celiac trunk. So this is the celiac trunk. You see the left gastric artery coming from the celiac trunk and supplying the upper part of the right side of the stomach. So this is the right side of the stomach, right border of the stomach, but the upper part of it is supplied by the left gastric artery. So you see the left gastric artery gives off these short branches, supplying the upper part of the right border or the right side of the stomach. So remember that left gastric artery comes from the celiac artery, goes up to supply the upper part of the right border of the stomach. Now let's look at the next artery. Now the next artery is the right gastric artery. So the right gastric artery arises from the hepatic artery at the upper border of the pylorus and supplies the lower right part of the stomach. So the right part of the stomach has an upper part and a lower part. The upper part of the right part of the stomach is supplied by left gastric artery, while the lower part of the right part of the stomach is supplied by the right gastric artery. So right gastric artery supplies right part of stomach, but the lower part of it. The upper part of the right part of stomach is supplied by the left gastric artery. So let's identify the right gastric artery. And this right gastric artery is coming from hepatic artery. And remember, hepatic artery also is coming from celiac trunk. So let's go back here. So here, let's identify our right gastric artery. So our right gastric artery, this is it. You see this artery here? This is right
gastric artery.
This is the right gastric artery. These branches that supply this lower part of the right part of the stomach. The lower part of the right part of the stomach supplied by right gastric artery. And right gastric artery is a branch of hepatic artery. So proper hepatic artery. And proper hepatic artery, you see, is coming from celiac trunk. From celiac trunk, you have the proper hepatic artery, and then the right gastric artery branches from the hepatic artery and comes to supply the lower part of the right border of the stomach down to the pylorus region. So if they ask you what arteries supply the right part of the stomach, the right border of the stomach, okay, you say the right border of the stomach or the lesser curvature of the stomach is supplied by the left gastric artery and the right gastric artery. The left gastric artery supplies the upper part of the right part of the stomach, while the right gastric artery supplies the lower part of the right side of the stomach, okay, and the pylorus. So that is blood supply to this part of the stomach, the right part of the stomach. Now let's look at the blood supply to the left part of the stomach. Now we have another artery which is called the short gastric artery, the short gastric artery. So these short gastric arteries, they arise from the splenic artery and supply the fundus of the stomach. So the short gastric arteries are coming from the splenic artery and they supply the fundus of the stomach. So let's go identify the short gastric arteries. So here you have your spleen here. And this spleen, you see these arteries here, these short arteries, we call them the short gastric arteries. They are coming from the splenic artery. So the main artery that supplies the spleen is called the splenic artery. But this splenic artery is running, look at it, it's coming from the celiac trunk also. So this is the splenic artery coming down here to supply the spleen. But before it enters the spleen, it gives off some branches which are going to the fundus of the stomach. So these branches are called the short gastric artery. So if you are asked in an exam, which arteries supply the fundus of the stomach, you say the fundus of the stomach are supplied by the short gastric arteries, which branch off from the splenic artery. And the splenic artery is coming from the celiac trunk also. So fundus by short gastric artery, upper part of lesser curvature by left gastric artery, lower part of lesser curvature by right gastric artery. Now let's look at the remaining part of the greater curvature, which arteries supply them. So we have the left gastroepiploic artery, the left gastroepiploic artery, or the left gastroomental artery, or the left omental artery. So you can also call it gastroomental or gastroepiploic. In case in an exam you don't see epiploic, you will see omental. So left gastroomental artery arises from the splenic artery and supply the greater curvature. So let's identify the left gastroepiploic artery or gastroomental artery. So here you see this artery here, left gastroomental or left gastroepiploic artery also comes from this splenic artery. So you see it here, supplying the upper part of the greater curvature. The upper part of the greater curvature is supplied by the left gastroepiploic or the left gastroomental artery. Then for the lower part of the greater curvature, it is supplied by the right gastroepiploic artery or the right gastroomental artery. But this time, the right gastroomental artery is not coming from the splenic artery. It is coming from what we call the pancreaticoduodenal artery. So this artery here, pancreaticoduodenal artery, this one, what gives rise to the right gastroepiploic artery. So the right gastroepiploic artery supplies the lower part of the greater curvature, and then it anastomoses with the left gastroepiploic artery that supplies the upper part of the greater curvature. So both of them supply the greater curvature. So blood supply to the greater curvature is by left gastroepiploic artery coming from splenic artery and right gastroepiploic artery coming from pancreaticoduodenal artery. And then fundus supplied by short gastric artery, which is coming from the splenic artery. So that is the blood supply to the stomach. Now, right gastroepiploic artery arises from the gastroduodenal branch of the hepatic artery and supplies the stomach along the lower part of the greater curvature. So the gastroduodenal branch of the hepatic artery is this one. So this is the hepatic artery. So a branch of it comes down here. So here you see the gastroduodenal artery, or the branch of it comes down here to form this pancreaticoduodenal artery, and then which now branches off to form the right gastroepiploic artery or gastroomental artery. So this is the blood supply, arterial supply of the stomach. Now, this is very important because when we begin to look at what we call portal hypertension later, you will see how why this blood, the anatomy of blood supply of the stomach is very, very important. Okay, good. So let's quickly run through it again. From this diagram. You see, let's take part by part. So we said there are 5 main arteries that supply the stomach, and these 5 arteries are all coming from the celiac trunk. When we look at the lesser curvature of the stomach, we say that there are 2 arteries that supply it, and these 2 arteries are the left gastric artery and the right gastric artery. So left gastric artery and right gastric artery. Left gastric artery comes from the celiac trunk. Left gastric artery comes from the celiac trunk. And then we have our right gastric artery, which is coming from the hepatic artery. So both of them supply the lesser curvature, right gastric and left gastric and right gastric. So the upper part is supplied by the left gastric, by the lower parts and the pylorus is supplied by the right gastric. Then for the fundus, we said is supplied by the short gastric arteries, which are branches of the splenic artery, supply the fundus. And then the greater curvature, upper part of the greater curvature is supplied by the left gastroepiploic artery or gastroomental artery, while the lower part is supplied by the right gastroepiploic or gastroomental artery, which is coming from the pancreaticoduodenal artery, which came from the gastroduodenal artery that came from the hepatic artery, while the left gastroepiploic artery came from the splenic artery also. So this is the blood supply to the stomach. Very, very, very important. Very important. Okay. Here you can see some branches going to supply the esophagus. Later we'll pick the esophagus and look at the blood supply to the esophagus. So some branches from this left gastric artery, some short branches go to supply the esophagus. So these are the esophageal branches of the left gastric artery. Yeah, so that is the blood supply to arterial supply or to the stomach. Let's quickly look at the venous drainage. It's very short. Venous drainage. So the veins of the stomach look exactly like the arteries. They answer the same name as the arteries. So where you have the left and right gastric arteries, you will have the left and right gastric veins. So here, this lower, lesser curvature, what you will see is left and right gastric vein, left and right gastric vein. and they drain into the portal vein. They drain into the portal vein. Remember, we said in the lecture we had yesterday that portal vein received blood from the gastric vein, the pancreas, and the spleen. Yeah. So the right and left gastric vein drain into the portal vein. And then we also have the short gastric veins and the left gastro-omental vein. They join the splenic vein, because we already said that the short gastric artery and the gastroepiploic arteries, they come from the splenic artery. So for the veins, they join the splenic vein. But the right gastroepiploic artery, we said, was coming from the pancreaticoduodenal artery. So for the vein, it will join the superior mesenteric vein. Now, all these veins will eventually drain into the inferior vena cava. Up here, you find the inferior vena cava. So they all drain into the inferior vena cava and then returns to the heart. Yeah, so this is all you need to know about arterial supply and venous drainage of the stomach. So quickly, name the 5 arteries that supply the stomach.
The left gastric artery, the right gastric artery, the short gastric artery, the left gastro-omental artery, and the right gastro-omental artery.
Good. And you know where each of them supply, yeah?
Yes, sir.
Very good, very good. So
I can see if you want me to see it.
Sorry?
I can see where you want me to where the supply. I can see it.
Good, very good. Okay, so that will be all for today. Do you have any question?
No, sir.
Okay, thank you so much.
Have
a good night. Yeah, bye-bye.
No, sir.